Hi everyone, Healthhannex TV, an online natural health platform where we look at the failed prove concepts and guidelines of natural health to recover and maintain health, especially in the field of sexual dysfunctions, anti-aging and fertility. You're welcome. Today, I will look at 12 common signs of hormonal imbalance in men. Men, like women, can be affected by changes in levels of insulin, adrenaline, steroids and growth hormones. However, men are most likely to be affected by imbalances in testosterone levels. Partly because it's not typically a common topic for discussion amongst men, any symptoms that might be attributed to hormone imbalances are often disregarded until they start to seriously affect an individual's quality of life. These are the signs of hormonal changes. Deterioration in muscle strength, acne, lack of energy, disturbed sleep, memory loss, whole body hair loss, weight gain, frequent urination, anxiety and depression, irritability, poor concentration and indecisiveness, low sex drive and impotence. What causes male hormone imbalances? The endocrine glands that control hormone regulation can be affected by environmental and lifestyle factors, as well as by some medical conditions. Factors that may play a role include chronic stress, obesity and overweight, overactive thyroid, overuse of anabolic steroids, exposure to environmental estrogens, diabetes, type 1 and 2, poor adrenal function, puberty, aging, environmental toxins, pollutants, pesticides and herbicides, poor nutrition, digestion and absorption, diets with a high glycemic index. Male health conditions associated with hormone imbalance. Male hormone imbalances can result in a number of health disorders including erectile dysfunction, benign prostatic hyperplasia, BPH, impotence, acne, male pattern baldness, gynecomastia, low libido, infertility. Some of these conditions are due to elevated levels of insulin or decreasing levels of testosterone, and in some cases an imbalance in the ratio of estrogen to testosterone. BPH is a non-cancerous enlargement of the prostate. It is characterized by the urge to urinate frequently as well as difficulty passing urine. The hormone dihydrotestosterone (DHT), derived from testosterone, is thought to be a key player in the overproduction of prostate cells that lead to this condition. Erectile dysfunction and impotence. Erectile dysfunction and impotence is one of the most distressing symptoms men seek medical help. It is thought to be due to a reduced production of testosterone, which upsets the equilibrium between androgen and estrogen, raising estrogen levels. Exposure to environmental estrogen is also implicated. As well as hormone imbalances, two of the most common causes of impotence include alcohol consumption and smoking. Hormonal acne. Hormonal acne is a condition common amongst men that develops in response to hormonal changes such as increasing testosterone levels. Rising androgen levels can trigger elevated sebum production, inflammation and colonization of bacteria in the hair follicles, which culminates in acne. Acne is regarded as an androgen-dependent disease, but it seems the hormones insulin and IGF-1, insulin-like growth factor, are also implicated. IGF-1 has a direct influence on androgen regulation of the skin. According to research, nutritional influences that increase IGF-1 secretion are frequently linked to acne. High milk consumption is associated with a 10 to 20% increase in circulating IGF-1 levels, particularly skimmed milk. Male pattern baldness is thought to develop when the body converts testosterone into DHT, although there may be a genetic factor to it. It seems some men have hair follicles that are sensitive to an excess of DHT, which causes the hair follicles to shrink. This can result in finer hair and eventually baldness. Gynecomastia. Gynecomastia is a swelling of the male breast gland, caused by an imbalance of the hormones testosterone and estrogen. As well as swollen breasts, individuals may feel tenderness in the breast tissue. Certain diseases and some medications can also cause gynecomastia. Low libido. Low libido. Again, this is often due to low testosterone levels, but may also be caused by certain medications, ill health, depression, recreational drugs, excessive alcohol, relationship issues and erectile dysfunction. Lack of libido is far less common in men than erectile dysfunction. Infertility. Infertility is the inability to conceive. For some men, low levels of testosterone may result in decreased production of sperm. Other factors that contribute to this can include a poor diet, smoking, stress, excess weight, environmental estrogens and prostate disorders. Natural support for male hormone imbalance. There are 6 key strategies for balancing male hormones. The good news is they are all easily established with a little determination and a positive approach. Number 1. Introduce good nutrition and supportive supplements. High-quality, nutrient-dense food is the best place to start, and you should aim to work as naturally as possible with food by avoiding highly refined and processed foods that are full of sugar, salt, saturated fats, hydrogenated trans fats, additives and salt. You can spot these by checking labels on food packaging. To maintain healthy hormone balance, you need certain nutrients in order for the body to produce and regulate them, which is dependent on optimal digestion and absorption. Many factors can affect your digestive system, particularly your choice of foods. Some people are better able to cope with certain foods than others. Ideally, your daily diet should include good quality lean protein, such as fish, chicken, eggs, nuts, seeds, beans and pulses, coupled with 5 to 7 portions of vegetables and 2 or 3 portions of fruit, preferably organic. Berries are a particularly good choice because of their low sugar content and high levels of antioxidants and flavonoids. If you are not avoiding gluten, then moderate portions of organic whole grains that are high in fiber can complement a healthy diet: millet, quinoa, oats, barley, rye and bulgur wheat. Fiber helps to carry used hormones such as estrogen from the body. Healthy fats are especially important. The omega-3 essential fatty acids found in walnuts, flax seeds and oily fish are vital for maintaining cell membrane flexibility, which helps with the transport of hormones in and out of cells. Avocados, coconut oil, flaxseed oil, walnut oil and nut butter are great additions for a healthier diet too. Supplements can be useful to make up shortfalls where the body has clear deficiencies or absorption issues. They can also provide more concentrated levels of nutrients, working faster than many foods, particularly in situations where access to high-quality organic foods is challenging or hindered by a busy timetable. Prostate health can be improved by focusing on nutrients such as zinc, vitamin C, vitamin E and omega-3 essential fatty acids. Pumpkin and sunflower seeds are rich sources of zinc and vitamin E. For a boost of vitamin C, go for guava, broccoli, kale and bell peppers, which contain high levels. Erectile dysfunction ED, happens when blood flow to the penis is restricted. This may be improved by including arginine in the diet. Arginine is an amino acid that produces nitric oxide, which naturally dilates the blood vessels, thereby helping maintain blood flow to the sexual organs. Arginine can be found in a range of foods such as turkey, pork, nuts, legumes, and whole grains. The herb ginkgo biloba can be beneficial because it helps to widen blood vessels, promoting healthy blood flow. Encouraging results from one trial on 60 patients with ED not responding to standard medication found that 50% of the participants had regained their potency. Ginkgo leaves can be used as an infusion for tea. Korean red ginseng has the same positive effects on blood flow and is supported by research. Male pattern baldness might be prevented by drinking green tea and taking plant remedies such as saw palmetto. These are thought to play a role in keeping DHT formation low. Infertility can be multifactorial, but if sperm number and motility is an issue, there are a number of nutrients to support healthy sperm. The minerals selenium and zinc, together with omega-3 essential fatty acids, plus amino acids arginine and carnitine, appear to help the sperm to reach their destination. Number 2. Support your thyroid function. Both hypothyroidism, low thyroid function, and hyperthyroidism, overactivity of the thyroid, are serious medical conditions and can affect all tissues of the body, including the endocrine glands. Free testosterone concentrations are found to be low in men with hypothyroidism and raised in those with hyperthyroidism, which can have a marked effect on bodily functions such as sperm production. Gynecomastia is commonly seen in men with hyperthyroidism, due to elevated levels of estrogen. Normal thyroid function is dependent on iodine and selenium. Foods that contain iodine include seaweed such as kelp and iodized salt. Brazil nuts and eggs are rich sources of selenium. However, individuals with hyperthyroidism should avoid iodine-rich foods. Eating large amounts of raw cruciferous vegetables can affect the uptake of iodine into the thyroid gland because they contain substances called goitrogens. Veggies to avoid are broccoli, Brussels sprouts, cauliflower, kale, bok choy, bamboo shoots and collard greens. However, cooking these vegetables destroys the enzyme responsible for activating the goitrogens. A diet containing high levels of saturated fat and green tea has also been shown to negatively affect thyroid function. If you have any concerns regarding your thyroid function, it is vital that you contact your GP and seek medical advice. Number 3. Stabilize your blood glucose sugar levels. After eating a meal, your pancreas responds to the rise in blood glucose levels by secreting insulin. This important hormone is needed to transport the glucose into your cells, after which blood sugar levels return to normal. Low levels of blood glucose can trigger the release of adrenaline and cortisol by the adrenal glands. These stress hormones prompt the liver to release more glucose into the bloodstream. Eating a diet high in sugar places an increased demand on the pancreas to produce more insulin, which may lead to insulin resistance. Constant fluctuations in blood glucose levels have a detrimental effect on hormone balance. Keeping blood sugar balanced throughout the day helps to regulate insulin secretion and reduce IGF-1 levels, which as mentioned earlier plays a role in the progression of acne. Replacing highly processed, sugary foods such as white bread, white pasta, biscuits, crisps, pastry and cakes, with complex carbohydrates such as vegetables, fruit, nuts, seeds and whole grains, helps to slow down the release of sugar into the blood circulation. Adding protein and healthy fats to each meal also help to control blood sugar balance. Number 4. Work on managing stress. Often stress is a major factor in male hormone imbalances. Chronic stress that is not dealt with results in elevated levels of cortisol, throwing hormones out of balance and increasing the risk of many health problems such as weight gain, high blood pressure, poor immune function and diabetes. Regular exercise can help the body to utilize stress hormones. It is also advisable to find quiet time for yourself to relax every day. Relaxation can be enhanced with the use of meditation, yoga and Tai Chi. According to research, rhodiola, a commonly used medicinal herb, can help the body to adapt to stress and is, therefore, a useful remedy for helping to counter the effects of chronic stress. Number 5. Get plenty of sleep. Whilst you are sleeping, your body carries out essential repairs using the main repair hormone DHEA, dehydroepiandrosterone. These repairs are most effective during deep restorative sleep, which is also enhanced by DHEA. Stressed people have difficulty sleeping and the subsequent lack of sleep means that DHEA cannot carry out its repairs. This increases stress on the body and so it becomes a vicious cycle. Keeping to a routine, by going to sleep at the same time every night and waking at the same time, even if it means setting an alarm, helps to maintain a healthy sleep cycle. The room you sleep in should be sufficiently dark and not too hot. Switch off your TV, mobile and computer well before bedtime to give your brain the opportunity to wind down. The herb valerian and the amino acid L-theanine found in black tea have both been shown to relax the body and promote restful sleep. Number 6. Support your liver. The liver helps to metabolize used hormones and eliminate them from the body. Men with liver disease have been shown to develop gynecomastia and spider veins as a result of the liver's inability to metabolize estrogen. Burdening the liver with too many environmental toxins and a poor diet can compromise its function. Liver health can be enhanced by avoiding alcohol, saturated fats and excess toxins such as caffeine, drugs, chemicals, pesticides, additives and solvents. The herbal remedies dandelion root and milk thistle have been shown to help improve liver function. That's it guys, I want to remind you very quickly that all the stuff we're saying here isn't really drugs, they're for information purposes, and it's best to check with your doctor before you go ahead and use any of these items. Often don't forget to subscribe so that you will know when we have new videos and then toggle on your alerts so that when new videos are loaded you will be automatically informed. That you can often share these videos with people who have or are going through these challenges and let them know. Alright. Thanks so much for watching. Have a good day. Remember, make your food your medicine and your medicine your food.